So thank you very much for the introduction. It's an honour to be here presenting this year. I came to Courtenay 2 years ago. I was a very inexperienced green coach at that point, and my national federation sent me here to basically try and learn as much as possible, and it's a great honour to be back here 2 years later to actually present and share some of the things that I've learnt in the past 2 years of coaching and working in sports science. So apologies in advance, my accent is a bit thick sometimes, and we Australians talk a little bit fast and slur our words, so if you don't understand anything I say, just put your hand up and I'll try to repeat myself. It's just part of the way we talk. So when I was asked to do this presentation, I sort of had a look around at what's been presented at these kind of conferences in the past, and this isn't exactly the right one. And it was quite obvious there's been quite a lot of work and presentations around sort of release parameters and the interaction of the Javelin in terms of trying to create the biggest distance possible. And 2 years ago, Frank Lehman gave a really great talk about the contributions of the body segments to the actual release itself. And if you haven't seen that presentation, do yourself a favour and jump on YouTube and have a watch, because he's presented some really excellent stuff based off of years and years of the German system, and it's really excellent. And so I was sort of thinking of something slightly more unique I could do based on my background as a coach and an athlete and a scientist. So I decided I'd talk a bit more about sort of the hip and shoulder motion and some considerations around how you can, optimize what you're doing in training and performance. And so I've had a quick look through the presentation slides just then, and sort of a theme I think is really common across everyone's presentations this weekend is individualizing training. So I think I definitely learnt this in the last 2 years as a coach. There's not one perfect way to throw a javelin. Every athlete has their own unique anthropometrics, strengths and weaknesses. And so rather than trying to fit your technical model to your athlete, you have to work within the own strengths and weaknesses of the athletes that you have. So rather than sit here and tell you that you're not going to walk away from this presentation with me telling you you need to be able to do this, this and this to be successful in javelin throwing, it's more I'm trying to talk about the motions that are occurring at the hip and the shoulder so that you can think about the way you do things and try and ensure that what you're doing in training is actually meeting the demands of the actual throw itself. So I'll just start with a little bit of a background on myself. I'll be really brief. I did my undergraduate degree in Sydney, Australia. I then did a master's degree at the University of Regina in Canada, which the Canadian guys are shocked that I would go to the middle of the country to study for 2 years, but I did. Competed in track and field. I was a very average decathlete. I'm currently enrolled in a Doctor of Philosophy or PhD at the Victoria University in Melbourne, and the topic is the biomechanical analysis and learning design for expert performance in javelin. Essentially what we're looking at is the difference between, short approach throws and full approach throws in trying to figure out what it is that changes when an athlete goes back to the full run-up. We're using Vicon 3D motion capture to try and quantify the motion, so a lot of research that has been published uses video, and there's a lot of assumptions based off those. So hopefully what we're doing is slightly giving us slightly better insights into the complex joints of the shoulder and the hip. In terms of work, I started off at Biomechanics at the Australian Institute of Sport. I spent a year working in the track and field program and then started my PhD. And in that year, I got asked to coach Kelsey Roberts. I hadn't coached javelin at that point in my life. I was purely just studying it because I thought it was an interesting event within our sport. And I very quickly had to upskill myself in coaching. I was very fortunate that Grant Ward, who's up the back there, sat down and gave me a very thorough education in javelin very early on. And last year I was put on as an apprentice field events coach for Athletics Australia, so I coach javelin throw, where I have Kelsey, and I had an athlete at the Paralympics as well. Coach long jumpers. I've got a 790 and a 660 male and female jumper I work with, and I coach combined events. So I'm sort of a generalist, as much anyone who's been a decathlete themselves probably fancies themselves. They know a little bit about everything. And so I guess I see myself more as a coach who has a background in science rather than a scientist who dabbles in coaching. And so again, from our presentation today, I'm not going to get too caught up in the semantics and the absolutes on the science side of things. I think with especially research in elite sport, it's very hard. The published research is based off averages and means, whereas with large standard deviations, and it's within those standard deviations that we see the individual aspects of each thrower. So again, I'm not going to tell you that anything in absolutes. What I'm going to talk about are considerations. Originally, I was asked to sort of talk about biomechanics in Australia and the way we do things. As you can see, Australia's a pretty big place. And unfortunately, we have some great state institute, but we don't really have a national system like the German system in terms of lots of historical data, so we kind of work in pockets and collaborate with each other. As you can see, over in Perth, which is somewhere over in Portugal, we've got Grant Ward with Kim Mickle, Luke Can, an 80-metre thrower. Over on the east coast, we've got Hamish Peacock, our Olympians based in Hobart. Kelsey and Catherine Mitchell at times are based in Canberra at the Australian Shooter Sport. We've got some good throwers in Sydney. We've got our 13th place Olympian, Josh Robinson's up in Brisbane. So Australia is quite a large place, and obviously it presents challenges, which I'm sure everyone here has within their national federation as well. So start off with, we'll just go through Biomechanics 101, a javelin throw. And so, there's been a lot of really great research over the years around release parameters and trying to figure out exactly what makes a javelin go really far. And it sort of boils down to these main themes. Velocity, the angle of the javelin, the height of release, the wind, and the properties of the javelin. Some of these things don't change much, such as the release height. Some of these things you can't control yourself, such as the wind or environmental conditions. At the end of the day, most of the research will tell you that release velocity is the king. It's the one that, if you increase that, the javelin's going to go further. Obviously, the angle is important as well. So what we're sort of looking at is, for an 85 metre plus throw, you're looking at sort of 28 to 30 metres a second at the release point. So your run-up velocity is anywhere, probably for an elite male, looking at about 7 metres a second. Coming into the delivery position, and from the point of back foot contact to release, the javelin's accelerated another 20 to 25 metres per second in an instant, which is about 0.1 to 0.3 of a second. So a really rapid acceleration of the javelin in a very short period of time. And so the actual acceleration of this javelin is caused by obviously the motion of the athlete themselves. And unfortunately, that's a lot harder to quantify than simply what the javelin's doing at release. And so there's been some really good research in the past looking at the linear joint center velocity. So the linear joint center velocity would be the velocity that the joints reach in the direction of the throw. So if we start at the javelin itself, so at release point of the javelin here, this is probably about a 55 metre throw, is reaching, say, 23 metres a second. And if you work your way back down the chain, we go from javelin to wrist to elbow to shoulder to hips. So on the at 0 on the far left there, we've got back foot contact. This line here is front foot contact, and this point is release. So it just sort of neatly shows the summation of forces. So there's a proximal to distal increase in the joint center velocity. So proximal closer to the center of the body, to distal out towards the extremities. And that sort of shows, that whip effect we get. So we accelerate the shoulder, which accelerates the elbow, which accelerates the wrist, which accelerates the javelin. And it's really good to see that obviously that happens, but the linear joint center velocity increases themselves are caused by changes in the angular motion, so the motion occurring at the shoulder, at the hip, at the elbow, at the wrist. And these things are a lot harder to obviously quantify, especially in the competition environment. And I think what's more important is understanding what is causing this angular motion and whether there is actually an ideal sequence of motion which will make the javelin fly further. We're all on the same page, yeah? Cool. So I chucked this slide in at the last minute. I've added a little bit extra explanation to the graph. I realised I hadn't actually explained it too much. I'm not sure if you guys actually got the notes for these ones, but these slides will all be handed out to you guys at the end, so don't feel the need to be furiously writing down everything I'm presenting. So this graph here is based off a simulation of release parameters. So on the x-axis here, we've got the release angle, and on the y, we've got angle of attack. So the two main, I guess, two most important release angle factors when throwing a javelin. So what this graph is showing for a constant release velocity, and I think it's about, say, 30 meters a second. So for a constant release velocity and a constant set of environmental conditions, so we'll just assume there's no wind, nothing acting on the javelin. Any changes in release angle or release attack angle can actually cause variation in how far you throw, right? So for any given velocity, there's a set of release parameters which are absolutely optimal and result in the javelin going the absolute furthest. So in this graph, it's the black dot in the middle. But then for every suboptimal or slight change you have at release angle and release velocity, there's obviously still outcomes that you can get. So each contour line there is there's about a 10 centimeter deviation from the optimal result based off the parameters. And as you can see, for changes in up to 5 degrees in release angle and 10 degrees in angle of attack, it can only make anywhere from 10 centimeters to 2 meters of difference. So, despite not being optimal, still suboptimal, or only slight deviations in release parameters can cause only slight changes in how far the javelin goes. And what Bartlett and Best were trying to say in this is that athletes may achieve these suboptimal conditions using different movement patterns. So, we could line up 10 throwers, get them to release this javelin at that speed and at a certain angle, an angle of attack, and they're all going to achieve it in a slightly different way. They're not going to be, for different throwers to achieve the same outcome, there's always going to be a different solution, so there's going to be slight changes in the way they do things. So I guess what I'm trying to build the case for is that there isn't one perfect way to do things, and case in point here, we have 3 of our best female throwers in Australia. We've got Kim Mickle up the top, Catherine Mitchell in the middle, and Kelsey Roberts on the bottom. So this was in the 2014 season when Kim and Catherine threw 66. I think Kelsey threw 63.90 that year. This was all at a competition right around when they're at their absolute best for the year, and you can see for, very good, legend. For 3 throwers who are throwing around the same area, there's very big differences in the way that they achieve that release velocity. So, Kim's the classic sort of shorter arm thrower. She gets a lot more elbow flexion, but gets really good external rotation, gets a lot of lift out of the javelin that way. Catherine and Kels hold their arm back a lot more. And in this particular throw, Kels is probably more closed off than Catherine. But Catherine then really uses the lower body well to hold herself up and hit through the jab, whereas Kels probably loses contact. At release, they were still similar positions, different degrees of hip rotation and extension through the right hip. So, and even the way they come into the throw is completely different there in terms of being more front on, more side on. So again, within 3 throwers within the same country, within what could possibly be the same technical model, there's 3 different kinds of outcomes. And again, you look from the back, 3 throwers throwing similar distances, very different positions that they're hitting. So what's really important as a coach is to understand what your athlete does and what is probably an optimal movement for them, and then trying to prepare them for those positions. So again, you look at the angle of yaw, so the angle relative to the direction of throw. Kim and Catherine got a greater yaw angle. Kelsey comes more over the top, but to do that she has to have more lateral flexion than these two. So again, I'm just trying to build the case that there's a lot of variation within throwers, and case in point, this was the Diamond League a few years ago, and just an elite women's field, so a little subset of a high level of female throwers, and within it you can see big differences in the anthropometrics, tall, short, different levels of strength. There's probably different technical models happening, but these girls all are very, very close in terms of the absolute distance that they can throw the javelin. So again, what I want you guys to walk away from today is not so much, I'm not going to give you the answer into how to make your throwers better, but I want you to walk away and be able to challenge what you do and what your technical model is, and look at the way you design your training to see whether you can do things better. So with that in mind, we'll get into the actual hip and shoulder contributions. So while I'm going through everything today, I want you to think of these 4 areas of the different types of loading. So we think of what's occurring in the javelin throw and the actual physical demands of it. There's probably 4 areas that a coach has to consider when they're designing training. So the first one's the type of load. So this could be whether it's an external load, so whether it's ground reaction, the reaction force of the ground. It could be the weight of the implement that you're throwing. It could be internal, so the forces acting at the joints, so the muscles working across the joints is going to be a certain type of load, whether it's an eccentric or a concentric motion. And so again, understanding what's happening in the movement will help you determine what type of load is occurring. The magnitude of the load is obviously important. So in throwing, we probably use different weights of implements and barbells and such in our training. So the javelin itself is pretty fixed. In competition, we're going to have a 600 or an 800 gram, but our choice of implements in training is going to determine what the magnitude of the load is. And obviously, if we look at short approach throws versus longer approach throws, the velocity of your run-up changes, which changes the magnitude of the load during the delivery phase. So, we've seen data reported of up to 7 times body weight through the block leg in the delivery of the javelin, which is pretty high. You don't see much higher forces than that in a lot of other sports. I think probably the most important aspect of javelin throwing in particular is the rate of loading. So, as I said before, the delivery phase is very short. We're looking at sort of 0.3, 0.4 of a second, and we're creating massive increases in velocity in that short period of time. So there's very rapid positive and negative acceleration values. And so just for ease of understanding for the rest of the talk, I'll talk about negative acceleration as deceleration, so slowing down. It might not be perfectly correct in the scientific world, but just for ease of understanding with the coaches, I'll talk about acceleration and deceleration. So again, obviously we experience high acceleration of the javelin, but also high deceleration of the joints after you've let go of the javelin. So especially at the shoulder, there's massive loads to obviously speed the arm up, but then the actual, after you've let go of the javelin, you're trying to stop your arm from falling off essentially. So there's a very large eccentric force acting, and things like that are really important to understand when you're designing your training, your strength. And finally, and this is where coaching is very important, it's understanding how frequent you need to put an athlete under load to gain and benefit. So this is the whole art of coaching. So understanding the type, the magnitude and the rate of loading of the exercise that you're doing, and then obviously being a smart coach and putting just enough of it in that you get a performance benefit without injuring your athlete. All right, so we'll start with the hip. So I've picked the two probably toughest joints to talk about in the body. They're both ball and socket joints. They've both got large ranges of motion, and from a purely academic perspective, these are probably the harder joints to describe in terms of what's happening. And so again, I'm just going to try and simplify things and just talk about describe the motion rather than get too caught up in things. So we talk about the hip and the pelvis as two slightly separate things. So the hip is the actual femur acting upon the hip joint. So the hip has flexion, and extension. It internally rotates, so rotates inwards, and externally rotates. It abducts, so moves away from the midline, and adducts, so move towards the midline of the body. And then we have the pelvis. So the pelvis, if you think about the 4 points, the anterior and the posterior portions of the iliac crest, the pelvis can anteriorly tilt, so tilt forward. It can posteriorly tilt backwards. It can tilt laterally, so to one side or to the other, and it can rotate, so it'll work through here. And these are obviously results of motion at the hip, but also further up the chain through the torso. So just give you a quick overview of some of the literature that's been sort of discussed this. As I said, a lot of this comes from Dr. Lehman's talk 2 years ago, which was really good. Again, I can't stress, so if you haven't seen it, definitely go and watch it. It takes a while though, so just make sure you block off an hour and a half. So basically what he was saying, and again, based off all the data they've got over the years of athletes in competition, a greater centre of mass velocity into the delivery phase is associated with a longer throw. So obviously being able to increase your run-up velocity, your initial velocity into the delivery is going to help you throw the javelin further. That's a real simple way to look at it. The longer throws also had a greater centre of mass deceleration from the point of front foot contact to release. So the longer throwers are able to hit, absorb, and slow down the left side. They'll slow down the centre of mass so that you get the big whipping effect up the chain. So again, a really strong hip girdle is important for that deceleration. The pelvis rotates and creates separation with the shoulders, creating pre-tension in the torso, which helps again with that elastic effect to throwing the javelin. And Comey, I think Tapio was actually on that paper, suggested a high leg extensor strength was required to maintain a block leg position and potentially utilise a stretch shortening cycle. So essentially what we're saying there is strengthen your left hip, your glute, all the muscles around it is really important to actually hold position into that block. So I think sometimes as coaches we can get a bit caught up in thinking about the knee angle and trying to maintain a straight block knee without taking into consideration what's happening at the hip. And I'll show you some photos in a few slides of a really fantastically straight block leg, but poor hip position, which is causing a big leak of energy through the system. And up front, I've probably missed a lot of other great research that's been done in that area, but I'm just providing a really small snapshot. So what I'll do is I'll go through the phases of the throw with just some photos of some Australian athletes. So this is Kelsey, who I coach. Feel free to give me some tips on how to make a throw further. So the first phase will really quickly go through the impulse. So the impulse is obviously the sweep into the delivery position. And depending on your athlete, depending on what you're trying to cue, there's essentially a sweeping motion. So this sweep through here is an adduction and a slight internal rotation of the right hip. And then the left leg is abducting, so moving away from the midline and flexing in preparation for landing. And then we hit the ground, and this is where the first real important aspect of the hip begins. So that initial ground contact, sort of the hip you can see is in a flexed position. There's flexion at the hip. On the right side, again, for the purpose of ease, I'm just going to talk about everything in terms of right-handed thrower. So if you're a lefty, just flip it around. I apologise. I coach a few lefties, so I feel your pain there. So there's initially the right hip's in flexion, and as you land and move past and over the top of it, the hip begins to extend. At the same time, the initial contact and that sort of moving past and over the top of the foot, the hip actually abducts, so the hip moves away from the midline. As you can see here, it's moving away, and there's a slight, depending on where your foot lands and relative to the direction of the throw, there's a slight external rotation. So if we think about this, it's essentially we're landing and absorbing that motion, so it's more of an eccentric action, which is a resistive action of the hip. The left hip continues to flex, so again this flexion angle here, and abducts and move away from the center of mass as it prepares to hit the ground. So at this point, and something I'll sort of talk a fair bit about, is the alignment of the pelvis is important. So the position that your pelvis is in when you land on the back foot probably determines where it's going to end up on the front foot and into the release. And I'll talk about that a bit more when we get to the front foot touchdown. So just prior to release, so this is just on back foot contact. This is a bit further along. So you can see the right hip is abducting and externally rotating, and then just prior to release, so depending on how early you start to turn the hip in, there's an adduction. So you drive the right knee in towards the midline of the body, big hip adduction and internal rotation. So, and this causes the pelvis to rotate, and this obviously demonstrates an active right hip, or whatever you want to call it. So essentially the big consideration here, and this is where the hip is and the adductors in particular are at a risk of injury, is there's initial land, eccentrically absorbing force, and then you're trying to work that hip in really quickly and create a lot of force to help help sort of accelerate everything else up the chain. So if you don't have the adductor strength and internal rotator strength through your hip to actually absorb and create the force there, you're going to put yourself at risk of actually, there's the lecture notes for it now, put yourself at risk of actually tearing an adductor or getting an injury through that point. So again, in your physical preparation, it's really important, and I'll go through this in a little bit, talk about the importance of the adductors. Just prior to touchdown, your left foot begins to adduct and prepare itself for landing, for contact. The hip continues to work in, assuming that you've got a nice active hip. It'll continue to adduct and internally rotate, and depending on how far it works past, it'll rotate anywhere up to 70 degrees from initial contact through to release. So there's quite a large rotation through the hip girdle. Essentially, it works through to its end of range of motion. The right hip will hit peak extension, and the left hip will hit its peak flexion some point during the release. So it's either, and again, that'll depend on the orientation of the pelvis going into the throw. There's a high eccentric load on the hip stabilizers to maintain that block leg position and reduce your center of mass velocity. So we go back to talking about a strong left hip. So coming into delivery, it's not just purely, the forces acting on your hip aren't purely straight line. It's not up and down. There's external rotators, so the ability to actually hit and resist that way is what's stopping your hip from coming in and dropping down. If you lose that left hip position, and I think Kelsey does it pretty well here, she manages to, it doesn't drop down, and you work up and over the top of the block. you have a greater transfer of the energy up through the throw. If you come in, hit, lose that left hip, you're already falling down and through the throw. So the ability to maintain that pelvic alignment coming into the throw is really important. And sometimes the actual degree of hip extension that you think you're getting on the right leg is actually not as much as it seems due to the anterior pelvic tilt. So if you have a pelvis that's tilted a lot further forward, your right hip actually doesn't extend. And so in any joint in the body, if you don't have that passive mobility to actually work your hip through the range, you're going to find range somewhere else. And in the hip, we do that by rotating the pelvis down. So if you don't have the ability to actually extend your hip back past level with the body, you're going to find it another way. And generally that's done by rotating the pelvis down. You rotate the pelvis down, you put yourself in a compromised position into the throw, which is what Grant Ward calls the special K position. So coming in, ending up down here, hip dropped. And I'll be the first to admit it, this is one of the big issues we have with Kelsey, we have had in the past, is this coming through. She has a really good ability to maintain a great straight block leg, doesn't get much flexion, but we land, her weight transfers too far forward, and boom, hip goes out the back. You're trying to throw the javelin from down here, you're going to lose a lot of energy. And essentially the next position from here is she goes barreling out the front of it rather than hitting, coming up over the top in a really controlled manner. And so weak left hip stabilizer is going to cause you to essentially blow through the throw and end up in that position. And it's common, especially when you're trying to add more speed to the throw, is that inability to actually hold positions coming through into the delivery. I'll just pause and let you guys get your notes. And so again, this is something we've been working on, and we've identified from our perspective, a lot of the strength training, a lot of things we do in the gym is designed on trying to move the weight as fast as possible. But we've actually gone back to trying to work on Kelsey's ability to actually decelerate and resist motion as much as we are trying to create it, so that we can try and improve her ability to absorb force and hold positions. Again, this is just the same sequence but from the back. So again, the pelvis tilts to the left, and that's normal as you come up and over the top. It's natural to have an increase in the anterior pelvic tilt, but as I said, excessive tilt suggests poor stabilization of the muscles acting about the hip, and it may, as a result, again, you lose the hip. You have to find range of motion through another joint, and you'll either excessively tilt to the left or fall forward and have excessive trunk flexion forward. Cool. So some really important considerations, I think, for the hip are these are things, again, that we've gone through with the athletes I coach, with our physiotherapists and our strength conditioning coaches, are passive hip range of motion. So once a week we measure the actual hip flexion, hip extension ranges of our athletes. We do it the same day every week with the same soft tissue therapists. So we're sort of tracking throughout the week whether there's a chronic change in hip range. And I think it's common, and it's probably an effect of our lifestyle these days. We spend a lot of time sitting down in a hip flexed position, and it's really important for athletes to learn how to release their psoas on their own without having to rely on manual therapy from a physiotherapist or a soft tissue therapist. And it can also be the result of previous training. So again, this is just the athletes I coach. We've seen a pretty good correlation with heavy squatting with losing range through hip extension, and it's more that chronic build up over a few days that's the issue. We don't usually see from day to day there's a big change, but if over a week or over a month we start to lose a couple degrees a week, that's when we can see if we're losing hip extension. We've got to find hip extension in another way in the actual dynamic movement, and we'll do that by tilting the pelvis down. Tilt the pelvis down, we'll lose the hip in the throw. So again, this is a really important consideration for us and the athletes I coach, and I'm not sure you guys might have the most flexible hips in the world, so you don't need to consider this, but again, today's just about trying to make you critically think about what you do and why you do it. Hip rotator stabilization is really important. Our great physiotherapist has developed a hip strength protocol, which I'll go through on the next slide, and we've sort of had enough data over the last 2 years to get a real idea of what's going on at the hips. And obviously javelin throwing is an asymmetric event. We're never going to be perfectly symmetrical beings. We throw with one arm and it's quite a dominant event. But what we sort of work towards with our athletes is approaching symmetry. So trying to find what the minimum level of strength for a certain movement is, and then trying to achieve that on both sides, and then trying to at least get the weaker side closer to the stronger side so that we don't have too much asymmetry. And finally, the eccentric control of the pelvis is really important for that transfer of the energy from the lower body to upper body. So again, a lot of strength training, we're just trying to move the load as fast as possible. We're trying to have a really explosive acceleration of it, whereas a lot of the demands of throwing are actually to resist motion just as much as it is to create motion. So whether it's through plyometrics or special strength exercise in the gym, it's really important to consider not only the load that you're putting through the pelvis, but the actual position and the orientation of your pelvis while you're doing a lot of the drills and your basic standing, walking throws. So this is a quick couple slides on the hip protocol that we do at the AIS. It was developed by our great team of physiotherapists, Ben Raysmith and Martin Wallen, who works with soccer or football. And essentially we do a series of hip dynamometry tests. So it's maximal contractions without movement. So we use the big power groups, so hip extension, hip flexion, which are your big, highly correlated to sort of squat, deadlift, clean strength, your quads and your hammies, hip adduction, abduction, and hip internal and external rotation. So we do these so lying flat in your stomach with your hip straight, so or bends over with your hip at 90 degrees. And what we've seen is obviously these are really important in terms of your pure strength to have good ratios between your quadriceps and hamstrings and flexion extension, but specific to Javelin, these deep hip rotator muscles have been, we're starting to see some trends that we think might actually either show injury risk or post-injury, whether an athlete hasn't quite come back strong enough. And so the outcomes we get, obviously, are absolute strength, symmetry, and we can hopefully identify some injury risks from it. Yes, Kari. Yeah, well, I'll quickly go through this, and if you have any more questions, I'll jump on it, Kari. You two always thinking ahead. So this is a fantastic, colourful graph, and I'll try and explain it as simply as possible. So on the left here, we have athlete A. On the right, athlete B. So I'll just talk about the athlete over here. So what we have is the motion and left and right side. And then we have a value, and that value is in newtons. And that's the absolute value that the athlete achieved in the test. At the top's their body weight and the date at which we did these tests. We've actually got these all the way back to 2014, but I thought I'd just show you a quick snapshot. So the movements with the blue arrows are the ones we see that we think are really important for javelin throwing. So left hip extension, glute strength, we think correlates with the ability to hold the block, so that's an important strength value for a thrower. Hip internal rotation with your hip at 90 degrees on the right side, so that would be the internal rotation, so the ability to turn inwards with your hip bent. So you think about the throwing motion, I talked about the hips always in some degree of flexion or extension, so being able to internally rotate the hip in that position is a pretty strong movement for a javelin thrower. Adduction, so towards the midline of both the left and right leg, are again very important in javelin throwing. Hip internal rotation straight is one we think has a correlation to or at least a back injury that we've seen. And hip external rotation straight-legged, so again, with your hip straight, your ability to resist external rotation is quite important in combination with hip extension on the left side in terms of holding a block. So as you can see here, we take these at different time points throughout the season. So in the Australian season, right now we're a couple of months into training. In between here, we have our domestic seasons from February to March. So we have the great challenge of having to, peak twice in a year because our summers are earlier, and then we have sort of the transition season, and then European comp season happens in here, and then back into it. And so this athlete here, and the bit I'll highlight is down here, is in early February, they were diagnosed with a stress fracture on the right side of their back. This is the right-handed thrower, right side lower back stress fracture. And we did the testing probably 2 weeks before it was fully diagnosed. I think they're experiencing symptoms at this point. And so, as you can see, in November, when they were perfectly healthy, they're pretty good values. And then 2 weeks prior to the injury, there was a big drop-off in their hip internal rotation strength, in both left and right, but definitely on the right. And then they were diagnosed with the injury and started the rehab process in start of March. So this test was done 6 weeks post-injury, and the left had started to improve, but the right, there was still inhibition. So the right, there was still, during this, stress fracture, you're looking at about 3 months of healing, so minimum. So this is only 6 weeks into the healing phase. There's still a drop-off in the hip internal rotator strength. And we're not sure whether that was an inhibition caused from the back. So it was purely a pain inhibition of the muscular strength, or whether it was an actual drop-off in the strength. And then even another 6 weeks later, start of May, both sides actually trended down again, but even 3 months later, at the point where the athlete was given the go-ahead to start throwing with some intensity again, there was still a big deficit in their hip internal rotator strength. So there's still something going on there that was causing inhibition of the strength. And in the meantime, there'd still been a lot of deloaded strength training, so still using alternate means to keep the strength up in the lower body. So there was still a lot of work in the glutes, the hips going on at this point, but there's still deep hip rotator strength. And as I said, we actually think it might have been not necessarily a drop in the absolute strength, but an actual inhibition caused from the injury itself. And so at this point, the athlete, we identified there was obviously a trend. So left to right, there's a big difference still. The difference had dropped off, but the absolute number was still down. And so from this point through to the Olympics, we put a concerted effort into isolating that hip internal rotator strength. And in the next testing session, which was post-Olympics at the start of the season, there'd been a trend upwards. So the strength had returned. The athlete hadn't felt any symptoms since probably around this first testing. So at this second testing point in May, the athlete was asymptomatic. They didn't really feel any lingering effects of the lower back pain, but there was still inhibition at that point. And then obviously just before I left Australia, we tested it again, and the hip strength has gone up again. So there's still a deficit left to right, but the absolute value has gone up. And I think, as I was talking about before, there's always going to be some asymmetry in your throwers, but just trying to understand what the absolute values, absolute change in values are is really important. So with this testing, we find there's about a 10% variation. So anything less than 10% we don't think is a meaningful difference. So anything above that we think could be meaningful. And so that's what we've been working towards. I think if we're looking at a similar stress factor on the left side, we'd probably look at the equivalent, the left side hip internal rotation strength as sort of a chronic adaptation to the healing process. And then I've given you athlete B. So athlete B it's a male thrower who's who's got similar absolute strength values to thrower A. He's obviously a little bit heavier, so power per kilo is not quite as strong. But he's had chronic back issues, more so down to his genetics than his actual necessarily the way he's throwing. But you can see for the same level of absolute strength, in fact, he's almost a fair bit stronger earlier on here. There's different degrees of asymmetry. So the areas where he's asymmetric are slightly different to this thrower here. So even though he can push a lot more weight in the gym, he's got a lot more issues with his hip rotators and asymmetries that we have to work through to try and bring him up to scratch. So again, this is a great diagnostic tool. We're starting to see areas which we think are important, and it might be eventually we may drop out some of these tests so that we really slimline what we do. But for now, it's given us some good insight, and hopefully we can either pick up the early signs of an injury or alternatively help ensure that our athlete's going to continue to, that we don't miss something in the rehab process. Kari, you all right? Yeah. Yeah, so I think there's definitely some minimum values which are an athlete has to achieve. So again, we still haven't quite got enough data on different athletes to understand that, but there's always going to be a minimum threshold. So we've got another athlete that came to us as a multi-eventer who went through this testing 12 months ago. Been quite successful athlete, almost at international level. And we've sort of got groups. We've got sort of race walk, sprinter, thrower, jumper categories. We can sort of see, we can compare athletes to within that. So this is a sort of high level athlete, sort of jumper sprinter. And their values were in the race walker category for most of their hip strength measures. So, this athlete is fast, can jump, and yet they're very weak through the hips. And so for them, they were getting some measures of adduction hip values in the 70 or 80 newtons, so very poor values, and they were chronically injured, had lots of issues. And in the last 12 months, their values have trended upwards, and we've made them a lot more resilient. So I think there's definitely minimum values, that especially relative to your absolute power strength in things like flexion extension. What they are, I can't quite tell you yet, but first of all, when we get an athlete, we look to bring those up to scratch, and then in the meantime, we try and work on the asymmetry and left to right differences. And as I said, it's all about approaching symmetry, not necessarily making a perfect athlete, because that's never going to be the case in a throwing sport. In a sprinter or a distance runner, you can probably work more on that, but for us, we've got to be working within what we've got. Anything else? Cool. All right, so the next one, I'll work up the chain to the interaction of the pelvis and the shoulders. So hip pelvis or hip separation angle is something, I guess, that we as coaches like to talk about. Obviously, that whole concept of you can create more separation, you're going to get more of an elastic whip effect up the chain in your throwers. So for the purpose of this, we're talking about shoulder alignment. So imagine I was a foosball or a table soccer player and you stuck a rod through my shoulders and through my hip line. So it's the alignment of hips and shoulders and the plane through here. So on the bottom here, I've got fantastic little representations of a human. So the red line is the shoulder line, the green line is the hip line. Riff, back foot touchdown, front foot touchdown, release, and they're throwing it in this direction. So the throwing arm would be here, the block leg would be here. So we know that this separation is important for creating what Frank Lehman called pretension, or almost a stretch shortening effect of the torso into the throw. We also know that if you can hold your shoulder back for longer, you create a longer arm, which is going to increase the acceleration path of the throwing arm. And so when you land on your back foot, most throwers will have shoulders basically parallel to the throwing direction. That's a pretty common thing. And so the actual degree of separation is more so caused by the alignment of the hips. So the absolute value of the separation between the hips and the shoulders is more of a result of what's happening at the hips, because generally we're all trying to land basically side on. Yeah, no one's really trying to land too much. Depending on the degree of your wrap, you might try and be a little bit further around. So essentially separation is created from the ground up in this sense. In cricket fast bowling, they actually counter-rotate through the upper body, whereas we're trying to create the separation by rotating the hips in whilst maintaining our shoulders back. As you move through the front foot touchdown, the absolute degree of separation doesn't necessarily change, but the orientation of the hips and shoulders do as you move through the motion. So there's actually not a massive unraveling or change in the absolute value. What we're just trying to do is hold that separation, so we're maintaining that stretch or pretension. And then through the release, obviously as you go to throw, there's an unraveling effect. The hip hits its end range of motion and the shoulders start to really rip through, and there's a decrease in the absolute value of separation. And I'll show you on the next graph a nice little continuous degree of separation that we're seeing, that I've seen in some of the Vicon testing we've done. So again, the beauty of the testing that we're doing for my PhD is we have 250 hertz, so 250 frames per second of data. And so we get this really rich, continuous information. Sometimes that can be a little bit saturated, almost too much information, but trying to make sense of it is obviously part of the fun. So again, we've got back foot contact over here. We've got front foot contact. This is the maximum shoulder external rotation here, and we've got a release point here. So there's time on the x-axis and then the separation angle on the y. So again, from what seen in previous sort of coaching literature and research, greater pelvis shoulder separation at front foot touchdown is again correlated with pretty longer throws due to that high pretension. And it's more so due to the rotation of the pelvis rather than the action of the shoulders. And so what we see here is, so from back foot to front foot touchdown, there's actually a bit of a change in the separation angle. And again, with the way we measure things, it's more a result of what we're defining as the hip joint center in our research. So that decrease in separation angle is just simply as the foot comes through, there's a slight change in the orientation of the hips to allow facilitate your foot to come through. So what we see essentially is when, by the time the front foot hits, that separation angle is still the same. So don't get too worried about this a little bit. This is just the motion of the front leg coming through, slightly closes off the hip and then opens up again into a touchdown. From the initial point of touchdown, there's actually a continued increase in the separation angle in this thrower. So this thrower, it's Kelsey's data, I'll just say it up front. Kelsey holds her arm back pretty well, so and has a pretty early right hip. So for her, she actually creates even more separation in that first instant at contact. And then obviously we see the rapid unraveling of the hips and the shoulders as the hip hits its end range, and we get that release of elastic energy up and into the throw. So again, I think it's really cool to see this continuous data because you can actually see the change. Like again, for this throw in particular, there's an increase in that separation angle, which occurs just after touchdown, and then a really rapid unraveling of the angle. So big takeaway from that, obviously separation is important, and again, the motion of the hips is really important in creating and using that separation. So it wouldn't be a Javelin presentation without this great photo here. It just really highlights the demands on the shoulder and on the body of Javelin throw. I think it's probably been used in every presentation I've ever seen. And so we'll get on the shoulder, which is probably, again, the toughest to actually describe in terms of motion. And so at the shoulder we have, again, it's a ball and socket joint, so we're looking at the motion of the humerus, upper arm relative to the shoulder joint. So there's essentially three main motions that I'll talk about. So horizontal flexion is the humerus traveling forward. So if you think about the throwing motion, the humerus relative to the direction you're throwing is always going to be moving forward. So we won't really talk too much about horizontal flexion other than to assume that it's happening. There's abduction, so up, and adduction. So again, in throwing Javelin, there's generally more abduction than adduction. Flexion and extension is another way to describe the motion at the shoulder, but for the purpose of today, I'll just simply simplify it and we'll just talk about abduction as the motion of the shoulder coming upwards, and then internal and external rotation of the shoulder. So you can all see my excellent external rotation, so rotating backwards, internally rotating, obviously going forwards. My Javelin PB was only a metre further than my 2 kilo discus PB, so I can't ever say that I know the feeling of throwing a Javelin a long way. So that's probably why I got into the science of it. I have to try and describe it in other more complex ways. And then also, obviously as a result of the shoulder motion, there's elbow. So we've got, the elbow is always going to be in a flexed position. It's just extending or flexing, and also the forearm relative to the elbow is pronating and supinating throughout the throw. And that's, again, kind of, I think, an important factor in the deceleration of the arm. So we know a little bit more about the shoulder in terms of its motion in the throw. Again, there's a big proximal to distal increase in the linear joint's center velocity. So again, you think of that whipping action, the shoulder accelerates the elbow, accelerates the wrist, accelerates the Javelin. However, the initiation of joint motion is not necessarily working in that order. So there's actually some really good work by this American group to suggest that the timing of the joint motion doesn't necessarily work in a proximal to distal fashion, and likewise the peak angular velocity of those joints. So they used a really big sample of American throwers from their national championships over a few years and got some really good data. And they suggested that there's actually some gender differences in the shoulder motion. So on average, the men initiated horizontal flexion of the shoulder before abduction, so they started moving forward before they started moving up. Whereas on average, the women started to move up before they started to move forward. If you, again, as I sort of prefaced at the start, if you look at research is based on means. If you look at it, there's quite a large standard deviation. So obviously within the male and the female subset, I'm sure there were surely female athletes that started moving forward before they started moving up, and likewise with the men. So take it as it is from a statistical research standpoint, yes, so there are differences, but again, understand what your thrower does first and then work around that. And they suggested that this difference is possibly due to physical characteristics. So we think of male throwers, they're probably a lot stronger through those anterior part of the shoulder, so they're more likely to shorten and pull forward first, whereas possibly just, again, speculating, females, they might roll up sooner due to a slightly less strength but more range to the shoulder. And again, understand what your athlete does and then work around that. And then the other one is they suggested that elbow extension occurs before internal rotation, so that motion starts occurring before we start rolling forward. And based on baseball research, I think this is a good thing. It reduces the torque at the shoulder, at the elbow and at the shoulder. But again, as I'll show in the next slide, one of the next slides, that there is obviously differences between and within individuals. So if we look at this example, you can see, again, horizontal flexion is continuous, so the shoulder's moving forwards through the range, through that plane of motion, so we won't talk too much about that. In this case, especially, there's abduction before external rotation, so there's the shoulder rolls up, so you see the elbow travel upwards, and from 1, 2, 3, so there's really a greater abduction first. And as a result of this roll-up or abduction, we call it a roll-up in our technical model, there's actually an increase in the external rotation at the shoulder during this motion. And so it's not a active thing. You're not going to consciously externally rotate your shoulder. So this is more of a passive increase in the range. So again, if there's a passive increase due to the motion of the shoulder rolling forward, you're starting to increase the load at the elbow and at the anterior portion of the shoulder. And so again, something you consider, which I'll talk about in a little bit, about how you prepare the shoulder for the throw. So peak external rotation then occurs, the actual abduction range isn't very much, sort of 10 degrees either way. It makes it look like it's a lot higher because as you laterally flex, the shoulders of the upper arm's obviously lifted. However, the actual degree of abduction doesn't change too much. We just tilt to actually get the shoulder up higher. So again, from a pure research perspective, there isn't actually as much abduction as you'd think. It's more a result of the lateral flexion. Peak external rotation generally occurs around about 90 degrees abduction, so sort of this point here. Again, in our technical model, we call it the bite. Steve Backley came down and did some sessions with us, and he used that term, and we've sort of jumped on it and really like the concept of that bite, that real point where you really feel the tension in the throw. Elbow extension, internal rotation start to happen sort of through here. You start to extend the elbow and internally rotate the arm. There's peak values here of anywhere between 1,500 and 3,000 degrees per second, which is quite a lot, and it's happening from front foot to release 0.1 to 0.15 a second, so you're accelerating the arm up to 3,000 degrees a second in that short period of time, so you can only imagine what the actual angular acceleration values are, and we're almost too scared to report those because the higher they are, the more saturation there is. It's actually quite hard, but you can just assume that those angular accelerations are very large. Just to give you some more different throwers, this is Josh Robinson and Hamish Peacock, two other Australian throwers. They're probably going to be angry at me. I didn't pick the absolute best technical throws, but it's kind of good to see the left-hander from this angle. You can see the degree of elbow flexion here. And then he hits that peak load, so the arm abducted 90 degrees, peak external rotation. He starts extending the elbow as he starts internally rotating. And likewise, Hamish comes in. These guys have a slightly more flexed arm to start with than Kelsey does, so it's just a slightly different look. Again, peak external rotation sort of occurring around here. And he starts to extend his elbow, internally rotate, And the forces acting obviously at the joints here quite high. In baseball research, this is the first position they say is a high risk of injury. And for them, they're throwing downwards with a lighter implement. So you can only imagine for us trying to throw upwards with a heavier implement, how much more stress we're placing on those joints. So on this graph, I've got shoulder abduction and external rotation. So the blue graph is the external rotation of the shoulder. Sorry, this bit here is a bit, I should have stopped at a frame earlier. Don't worry about that little bit of saturation there. This is the abduction angle. So we sort of, as she comes into the throw, back foot contact, front foot contact, peak external rotation and release. So as that front foot lands, there's a slight abduction of the arm, and external rotation continues to increase. And then as she starts to abduct the arm, after the initial drop, there's a continued increase to the point where she hits peak external rotation. So this sort of roll up here causes an increase in the external rotation angle, and then it begins to internally rotate as the shoulder continues to abduct and roll up. And then, as you can see here, the rate of change of the angle is quite high, and this is after release, we actually get the higher values of internal rotation. So it's actually quite a large forces acting on the athlete. Here's just a comparison of a 50-meter thrower and a 63-meter thrower. So the green line's the front foot contact, orange line is release. And it's just this is a short approach throw for both of them, and it's sort of just highlighting the differences in the kinematics between two throwers. You can assume who the 60-meter thrower is. So the 63-meter thrower has a higher external rotation value at peak compared to the shorter thrower. They have greater internal rotation from peak to release, so they get more out of the internal rotation than this thrower. And they actually start internal rotation before elbow extension. So elbow extension here, internal rotation. So they actually go opposite to what I was talking about earlier, whether or not that increases the load at the elbow. It's up for debate. Whereas this 50-meter thrower starts elbow extension before internal rotation, or it's just about the same area, but they have a greater elbow range, so they're more of they shorten the arm up a lot more, so you can see a big drop, but then they also get more extension of the elbow through to release, so they're getting more out of the elbow extension than they are out of the internal rotation. So again, two different throwers. I'm not saying that what the longer thrower does here is what makes it better, but it's just some considerations. So the release and what we call the catch is, again, another important area of the throw. As I said, peak internal rotation occurs after release. There's a rapid acceleration of the arm and then deceleration. Internal angular velocities of up to 3,000 degrees a second, so it's a massive load on the rotator cuff of the shoulder to actually catch the arm and stop it from falling off. As you release it, there's pronation of the forearm, as you can see here, and I think that is a pretty compromised position, but I think it's important to actually help slow the arm down. So again, eccentric strength is required, but also high velocity eccentric strength is required to decelerate the arm, and it's a high injury risk movement. So some considerations of the shoulder. I reckon I'm just going to come in on time here. Obviously, the eccentric loading of the external rotation at that initial bite position is quite high. It increases the loading at the elbow, the shoulder, and the internal rotation torque at the shoulder. So how we prepare for the shoulder and the elbow for this motion is obviously important. One way to do that would be to obviously condition the arm to experience high loads. So whether that's by throwing an overweight implement helps prepare the shoulder to handle extra force at the elbow. But in doing that, you've got to obviously understand the rate of loading and how many repetitions you do of it. So it's all good and well throwing heavier weights, but if they're not reaching similar velocities, you might not be conditioning it to handle the actual demands of the throw. The deceleration capacity of the shoulder is really important. Again, the rotator cuff and the lat work together to try and decelerate the arm, stop it from falling off. So that posterior cuff strength is a very important aspect, and I'll talk a bit more about it tomorrow with a demonstration with Kelsey. And so that deceleration capacity is only going to come from throwing things. So you think about it, the only way you can actually practice slowing your arm down is to throw something and try and slow your arm down. So something we've started doing a bit more in training, just throwing balls. So if you throw a baseball 80 meters, you're going to have to accelerate the ball to the same speed. You're going to have to accelerate a javelin to throw 80 meters, and you're still going to have the same deceleration capacity in the arm. You just won't have the same loading, obviously, through the shoulder. So, throwing things fast is going to help you prepare to handle the demands of throwing heavier things fast. So I think underweight implements are really important. Again, passive range of motion in the shoulder is important. So this is a phenomena they've seen in baseball pitchers. So it's glenohumeral internal rotation deficit. So in throwing arms, which is on the right compared to the left, there's actually a shift in the range of motion of the shoulder. So on an unaffected arm, they'll have 110 degrees of external, 70 of internal. On the throwing arm, you have an increase in your external rotation and a decrease in your internal rotation. It's still 180 degrees of total range of motion. It just shifts backwards, and I think it's something to do with the chronic load through and the way the humerus changes and interacts with the shoulder. So again, understanding that the shift is normal. So losing internal rotation compared to your non-throwing arm is the normal thing. But when you lose internal rotation compared to previous measures of yourself on your throwing arm, that's when it starts to become a problem. And again, I'll talk a bit more about this stuff tomorrow in our practical demonstration around how we screen for these things to ensure that we're not losing range of motion. Because again, if you lose range in your shoulder, you create it somewhere else. So knowing the difference between thoracic and lumbar extension is really important, and how that range is achieved. So again, a lot of really great, you go on YouTube or you hang around a lot of good throwers and they've got amazing ranges through their chest and their shoulder. And a classic exercise I won't demonstrate is overhead back forward throw. So you're trying to create as much range as possible to obviously increase the acceleration path of the med ball while you throw it. But if you're achieving this via lumbar extension rather than through your thoracic, it's probably not specific to throwing. In throwing motion, we don't really have much lumbar extension. Lumbar extension is usually a result of tight hip flexors and poor pelvic control, so we'd rather get range through our shoulder and through our back, through the thoracic than the lumbar. So understand the difference and understand when you're designing your drills that your athlete's creating range through your thoracic and not through your lumbar spine. And finally, we do hip isometric rotator strength. We tried to do that with shoulder strength. We found that there is some usefulness in terms of external versus internal strength. However, again, we'll go through it tomorrow. We've got, throwers have, if you did enough scan on if you went into a thrower's shoulder, you're going to find problems. We have an athlete with a supraspinatus tear, despite massive increases in strength and posterior cuff capacity and everything we've done functionally to improve the shoulder strength. External rotator strength in these tests just doesn't improve. There's almost an inhibition of the thrower in these tests. So I think, again, testing the shoulder is obviously something you can do. It might be predicted to your thrower, but understand the differences that, rather than trying to match your athlete to the testing tables of other athletes, the only purpose of testing an athlete is to compare them to themselves at a previous time point, right? You don't need to, if we looked at all those tables you see out there of, to throw 60 meters with a female javelin, you need to be able to do this, or these are general qualities. Kelsey would probably be a 45, 50 meter thrower on a lot of those tests. So rather than train to be good at tests, train to be good at throwing a javelin really far and understand what you're testing and why you're testing it. And I left you with a nice big reading list. There's plenty more stuff there, and 10:30 on the dot. Thank you very much, guys. Appreciate it. And Yep. Oh, yep. Sorry. Back foot, front foot, peak external rotation, and release. Sorry, I've got in a bit of a rush to put those graphs together at the last minute. So, and so yeah, I'll be around all weekend. Come talk to me if you have any questions about stuff, guys. I'm more than happy to talk Javelin.